Welcome to the Keeler University webinar series, and tonight we're going to have the Keeler Virtual Expo with Advancing Eye Care. My name is Shane Breen. I am the Training and Events Manager at Keeler USA. Some of our other speakers tonight are going to be Melissa Walton, our Northeast Sales Representative, Matthew Douglas, our Diagnostic Product Specialist. Our guest speaker this evening, Mr. Joe Sable with Advancing Eye Care, and John Fiak, our Regional Manager for the Northeast Territory with Keeler USA. First and foremost, we want to talk about COVID-19 and thank everybody on the call for the continued support, performing emergency cases, being on the front lines and dealing with COVID-19 just like we all are, but those who are truly, still treating patients and being in front of them to continue to offer that care. And from Keeler, we want to thank you for that. We also want to let you know that Keeler USA has been, and will remain open to assist you in any of your needs, whether that's clinical drops and supplies, the PPEs, diagnostic equipment, service, all of the above. Just let us know, and we want to be there for you. So thank you. And as you can see on the screen, just our COVID-19 statement, how Keeler is continuing to social distance in the office so that we can remain open, continue shipping, and help out everywhere we can. For the event, if you have any comments, questions, you'll notice the chat box in the bottom right-hand corner of your screen. In the comment box, just type in any comment you want, say hello. We'd like to hear from you. And if there's any questions, there is a second icon, which is a question mark. That will highlight your comment as a question so that we can field those questions at the end in our breakout meeting. And I'll talk about that in a minute. So PPE is what we're going to be talking about, as well as some equipment. Whether that's shields for equipment or equipment that can help now. So at the end, at this meeting, we're going to have a breakout meeting so you can have one-on-one sessions and speak to our speakers on the event for PPEs and clinical supply questions that we'll field. Again, Melissa Walton, Northeast Territory Sales Manager, and Matthew Douglas, the Diagnostic Product Specialist, will be speaking to the PPE products and the clinical supplies. And for the diagnostic equipment, Joe Sable with Advancing Eye Care and some items that he'll be talking about this evening, as well as John Fiak, our Northeast Regional Manager. Quickly, I want to highlight some things with Keeler and some of the things we offer, and I may have already said it, but a full clinical line of pharmaceuticals and supplies to help you. Our diagnostic equipment, whether that be from our BIOs, slit lamps, and ultrasound equipment, any of those pieces, please ask questions. And we have national sales coverage. So our national sales team of internal reps are there for you. So whatever state you may be in, please give them a call and they'll answer any questions that you have. But we have the nation covered. And then support. Our diagnostic product specialists are available to assist with training, troubleshooting, and support of any of the Keeler line of products. And just to show you a brief map, all of our reps available to take your calls, and just a brief snapshot of the coverage. At this time, I'd like to introduce our first speaker. Melissa Walton will be speaking first about personal protective equipment, some of the items that you're running against often in your clinic trying to get and source. Before I turn it over to Melissa, however, I'd like to put up a brief survey. Take your time. It's just one question. It's just asking about PPEs. Have you been able to acquire PPE products? And just choose anything you'd like there. So it looks like yes, but not easily. Luckily, and hopefully, Keeler will be able to help you with turning that yes, but not easily into a yes, easily. And to that, I'm going to turn it over to Melissa, who's going to speak about some of these PPE products.
Hi.
Thanks, Melissa.
Welcome. My name is Melissa Walton. I am the Territory Manager for Pennsylvania and Delaware. I'm just going to talk a little bit about some of the products that we're currently offering to help you maintain optimal patient care during this time. We know we're all navigating some very unique and challenging obstacles right now. So our mission as a company the last few months has been to source as many of these PPE options as we can for our customers and also our community. I say community because this isn't really just about us and our practices and our businesses anymore. Our own families are using these products. So it's become more of, I guess I should say, responsibility for us to find not only cost-effective products, but the highest quality. So we will continue to do so for as long as needed. So I will point out that all these products that I will talk about, we have currently and ready to ship. So if you need any of these, don't hesitate to reach out to us, reach out to your rep. You know, we can get you these items. We can ship them out as soon as tomorrow. So I'm going to start with our mask options. On the top of the screen, Shane's going to put a little link. There it is. You can click on that at any point during the presentation, and it'll take you to a really good video about wearing masks during slit lamp examinations. So first, we have our KN95 mask. As I'm sure all of you know by now, this is the Chinese equivalent to the American N95. The first question I usually get is, are they the same? There are things that are the same, and they're disposable or single use. And a true KN95 is going to be the same filtration as an N95 mask. The next question I usually get is, well, how do I know that my KN95 is a true KN95? This is where the CDC really stepped up and did their due diligence in order to regulate the sale of these. You know, we're happy to announce that the product that we have in stock is a true KN95. And if you need any type of documentation, FDA certification regarding that on masks that you purchased already or masks that you want to purchase, just reach out to your rep. We do have all that on hand to give to you for those that need it or want it. The masks are going to have ear loops instead of the N95 has the double strap around the head. So most people's concern with that, of course, is a secure fit around the nose and mouth, which is why we do have mask adjusters available to purchase. They're very cost effective. They come in packs of 10. So you can order those for any ear loop mask to create a tighter, more secure fit if that's a concern. Next, we have just a standard 3-layer medical mask. This is a standard single-use mask. Has ear loops instead of ties. You can also use the adjusters for this as well. This is a more cost-effective option, not as high level of protection as the KN95. This is just, you know, to protect the people around you, basically. These now also come in youth sizes, so you'll see the pink and blue masks on there. They fit 3 to 12 years old. So we didn't have those before. That's something that a lot of our customers have requested. So, you know, if you have anything like that you've been having trouble getting, that you want to know if we can source for you, just reach out to your rep, let us know, and we can see what we can do. Next, we have the just a reusable fabric mask. It's made from antibacterial fabric, not to be confused with antiviral, but antibacterial fabric, it means basically it was treated before it was woven with something that inhibits bacterial growth on the mask. So obviously it's not going to protect against viral infections, but it's still a good quality to have in a mask. So same levels of protection as your 3-layer medical mask. You're going to be protecting the people around you when you're wearing it. Also, again, it has ear loops and the adjusters can be used with this as well. The biggest question I get is if it has the adjustable nose bridge, and it does. So there is a wire sewn into it so you can create a more secure fit around the nose. All right, next we have some more face protection. We have shields and goggles. We have a full-length face shield. A lot of people, I think we've been talking about masks a lot over the last 3 months or so, that a lot of people are forgetting about protecting your eyes. It is very important. You can get the virus through your eyes just like you can your nose and your mouth. So it's definitely important to have protection, especially in the office if you're performing, minor procedures or anything like that. The face shield's going to cover your whole face. It is a longer shield. It has a plastic headband instead of the padded headband, but it is adjustable. The reason we went with this one is the padding sometimes comes a little bit farther out, so we found that something a little bit closer to the face is something that our customers really wanted. You can wear glasses under this and your regular medical mask, of course, too. Other options, we have standard scratch-resistant safety glasses. They do provide wraparound protection. So they're lightweight, they're comfortable, easy. And then for a little bit more of a secure fit, we do have goggles as well. My customers that have purchased goggles are normally ones that wanted to wear their glasses underneath something with a more secure fit. It does seem to be that glasses can fit pretty comfortably under those. Next, we have some sanitizers. All the sanitizers we carry are 70% or more alcohol content, according to CDC regulations. So we do have 3 sizes available now. We have 6 ounce, 16 ounce, and 33 ounce. The 2 smaller sizes come in a pump bottle. The larger size, most people I find have been ordering that so that they can fill their smaller pump bottles around the office because it is a pour top. So most people like the pump. We do have an organic. The GSL Organics one has aloe and moisturizers, essential oils. So if you have somebody with more sensitive skin, or if you've just if your hands have been drying out from washing and from overusing sanitizer, that's definitely going to be a better option. And then last, we've been providing a spray disinfectant. This is mostly because Sandy wipes, as I'm sure you know, have been really hard to get recently. We should have a generic purple top at some point, end of August, early September. We should be able to fill orders for that. But for the time being, this has been a really good substitute. It's a strong disinfectant. It was commonly used in hospitals, schools, hotels. It is meant for hard surfaces only. So I wouldn't apply this on your waiting room chairs if they're fabric, only on like door handles and hard surfaces, stuff like that. Some additional items. We have been carrying gowns for a while, but we just got these in multiple sizes. That's one of the big requests. We got people wanted small, medium, large, and we have extra large as well for a more appropriate fit. Next, the Masket eye patch, which has become extremely popular in the last few months. This is a great replacement for a pirate patch or an occluder. It's disposable. It's fully adjustable. It actually has a little slit on the patch that allows you to form it into a cone. If you have a patient with longer eyelashes or any kind of eye abnormalities, swelling, injury, anything like that, it makes it really comfortable for the patient. And they come in packs of 500. They're very cost effective as well. Next, the mask adjusters that I mentioned. Very simple product, but it's been awesome and very popular. In fact, I think we're almost out of these, but we should have more soon. We have people in the office that tried them. They work great. This is great for most of the masks that are available right now in the market because I think pretty much they're all going to be ear loops. So also, you'll find if you're wearing masks all day, every day, this can be a godsend for the back of your ears. I've had customers tell me that it's such a big relief to have these, and they're cost effective as well. They come in packs of 10 for, I think, like $12. So it's a really great product to have. Last, I'm just going to touch on the digital infrared thermometer. It's a non-contact surface temperature thermometer. I'm sure you're scanning your staff, you're scanning all your patients before entering the building. It's really fast, it's easy, it's reliable. I think the 2 AA batteries will last over 100,000 readings. So We've carried a couple different ones in the last few months, and this has proven to be the best as far as reliability and consistent readings. So it's a very reliable product. For any items that you're still having trouble getting, I urge you to reach out to us. Even if it's not mentioned here, we're constantly sourcing these things. So please let us know if there's something you can't get. Chances are somebody else is looking for the same thing. So if we get enough requests for it, we are definitely trying to source stuff like this. So please let us know. Next, I'm just going to talk briefly about our 2020 program, just to explain what it is, because all of these products that I just mentioned, they are eligible for the program. Basically, how it works is you earn points for ordering clinical supplies, pharmaceuticals, your dilating drops, all that stuff, and then you can then use those points to purchase diagnostic equipment. You'll see on the flyer there all the different tiers, all the different equipment options. There's binocular indirects, portable slit lamp, a B-scan. So, depending on how much you typically spend per year on your dilating drops and supplies, you can kind of get an idea of what you would be eligible for. The reason we did this is to take advantage of our two different product lines. We're in a unique position as a company to supply both needs on the RX and the equipment. We were finding that customers who traditionally ordered supplies and dilating drops didn't realize that we did slit lamps and binocular indirects, and vice versa. So it just made it a way that we could communicate that to everyone, while also giving a little something back to the customer every year. It is free to sign up. There's no upfront cost. All you do is fill out a quick online form, provide an email so that we can keep you up to date on your status, and you're good to go. Also, I think Shane's going to put up a link so that you can sign up pretty easily. You can click on that and it'll take you right to the form. We just added KN95 and the 3-layer medical mask to tier 1. So essentially you can order masks to get masks. So if you didn't need one of the pieces of equipment in tier 1, you could choose to get either 200 of the KN95 masks or 600 of the 3-layer medical masks. If you have any questions on this further, I encourage you to join us in the Q&A afterwards. We'll be answering all your questions on the program, on the PPE products. We'd like to get some feedback so that we know how to better help everyone in their practices moving forward. So please, I encourage you to stop in and we'll open up the discussion a little bit about PPE. Thank you. I appreciate you all for coming. Shane, I'm going to go ahead and kick it back to you.
Thank you, Melissa. Hopefully the earlier question of not easily finding PPE products has been answered. And if there's anything, like Melissa had said, that is not listed currently on the presentation, let us know, and we're going to look to source that item. I'm going to go directly into our next speaker, who is Matthew Douglas, and he is a diagnostic product specialist with Keeler. Again, available for training, troubleshooting, and support of all products, but he's going to be speaking about some of the shields available for your current product line or the current products that are in your lanes that can be shielded and offer an extra layer of protection. So now I'm going to kick that over to Matt. Matt, if you will jump in.
All right. Thank you for the intro, Shane. Hello, all, and good evening. My name is Matthew Douglas. I'm a product specialist here with Keeler. As Shane mentioned, my team and I are responsible for training customers on our equipment models and helping to troubleshoot any issues that you may run into. Tonight, I'll be reviewing a few of our most popular protective models. Our first section highlights the breath shields that we have in stock to help protect you while at the slit lamp. Each of the shields discussed can easily be wiped down in between patients and provides an additional layer of protection to our face shields and masks. Keeler offers a full line of slit lamps in both the upper illumination and lower illumination styles. If you have a Keeler brand slit lamp, then EP39-8 80753 is our best option for you. So this style of shield is very large and is compatible with a number of slit lamp models that have a removable ocular section. Our shield fits behind the lamp's oculars and attaches to a joint, commonly called the dovetail connection, and it can easily be attached and removed in a few moments. If you have any specific questions about the compatibility of our shields, again, please feel free to join us at our breakout session at the conclusion of the call. If you do not have a Keeler brand slit lamp or similar style, still have a very great option that fits almost all other slit lamp models. This second style of breath shield fits over the top of the ocular portion of the lamp and sits closer to the doctor during an exam. This shield is compatible with most Haag, Zeiss, Marco, and comparable options. It is easily slipped on and off the lamp and can be sanitized easily between exams. This item is part number AX17415. So again, this is a much smaller, but it does sit much closer to the doctor and provides another layer of protection. The same shield I just discussed is also capable of being applied to our portable slit lamp. Our PSL Classic and PSL 1 offer a portable and versatile alternative to our standard slit lamps. So you can take this portable slit lamp to anywhere your patients are. The PSL, just like the shield option, is lightweight, durable, and easily disinfected in clinic. This part number, again, is AX17415. This can be easily added to our PSL and covers our mouth and nose area. The next product I'm going to highlight is our disposable tonometer prism, the Tonomate. This product works perfectly with any Goldman style tonometer, including our standard Keeler applanation tonometer, as well as our new digital applanation tonometer. The Tonomate is a Goldman style disposable prism that is individually sterilized and packaged, allowing for placement on the tonometer with no direct contact with the prism. These prisms come in a package of 100, and the part number is 2414-P-7039. If you need any specifics about any of the products shown, again, we can address those in the breakout session later. Shown on this slide is our recently developed face shield for our indirect ophthalmoscopes. In this pandemic situation, the indirect ophthalmoscope is an invaluable tool. We have developed a shield to provide a large coverage area that wraps around your face. You can see it shown on this slide, and I also have one for display. Again, that shield provides a large coverage area that extends to both sides of the face, allowing for an examination with minimal risk to our doctors and patients. The shield itself is easily snapped onto our headband and can be removed in a few seconds by undoing our liner, removing the shield, and then replacing the liner. The last protective shield that I'd like to highlight tonight is product number AX17447, and this is for use with the phoropter. The shield will not get in the way of your examination and provides a 7.5 by 7.5 protective guard over your patient's nose and mouth area, and this adheres easily to most phoropter models. Moving along, our next slide highlights our cleaning recommendations for each of the product models listed today. Shown on the slide are a set of easy-to-follow instructions to effectively disinfect our numerous models with a 70% isopropyl alcohol solution. And this method can be easily used to a list of models on the right-hand side, including our telepuff, our slit lamps, portable slit lamp, pack pen, B-scan, and our new HD analyzer. To conclude this section, Keeler is currently sourcing as much protective equipment as we can right now for your clinics. We are getting new items in on a regular basis, but we need your help to help identify the items that will be most impactful and important for you in the clinic setting. So again, on these breakout sessions, please let us know what protective equipment that we can source and anything that you feel will help you in clinic. That concludes our section on the shields, and I'll send this back over to Shane.
Thank you, Matt. So plenty of shields, plenty of things that can be added to equipment other than just the regular PPE products which we're accustomed to wearing and having at our disposal now. With the additional shields to help out, will provide more protection for our practices, not only the employees and the doctors and technicians, but also the patients, and keeping that cross-contamination low. At this time, I'm happy to introduce our guest speaker, Mr. Joe Sable. Joe is the President and General Manager for the Lombard Core Products and Services.
Great, thanks, Shane. Appreciate it very much, and do want to thank Keeler for this opportunity to present. Keeler, you guys are a great vendor partner, and do appreciate this time, the opportunity. So, I do want to introduce to you all what Advancing Eyecare is and what our stance is during this new era, as we'll call it, the new normal, as what we're dealing with here with COVID-19 and so forth. So, start with, first of all, what is Advancing Eyecare? First of all, my title is, I'm Vice President and General Manager of the Lombard Core Division of Advancing Eyecare. So that one of those names in there might ring a bell, because most people don't know what Advancing Eyecare is, but they know what the divisions of Advancing Eyecare are. So Advancing Eyecare encompasses Marco Ophthalmic, Lombard Instrument, OII, EMS, Enhanced Medical Services, and then S4 Optics and Innova out of Canada. So my role and responsibility is I'm in charge of the Core Products Division. So that's under Lombard, OII, EMS, and OIC. Some of those names you probably are familiar with from a local distribution level. So first of all, what is Advancing Eyecare's COVID-19 stance? First of all, we are very concerned and doing our part to minimize the spread. All of our employees are making sure they're following all the CDC guidelines. We are open. We are working remotely if possible. We have strict sanitation protocols, and most importantly, when we do come on your clinic sites, we are following whatever protocols and procedures that you have and put in place. The bottom line is, though, we are open and doing deliveries on a regular basis. Furthermore, we do have some virtual resources. Of course, there's been so many different cancellations of trade shows basically since March with Vision Expo and so forth. So we've created a virtual booth, which Shane's going to put up on the top here. There it is on the green banner. So that is a link to our Advancing Eyecare website. So Marco, Lombard, EMS, to name a few. And basically you go into those and you'll have an option to go into the virtual booths, and you'll have the ability to, as close as possible, touch and feel the different offerings that we have and so forth. But more importantly, it gives you opportunity to make sure you take advantage of the different promotions that our manufacturer vendor partners are offering through the different trade shows. That one of the reasons a lot of you do go to those shows. So we want to make sure we can offer those promotions virtually for you. So along with Keeler and all of our industry partners, we are making sure that we have similar products to support you and make sure you're covered in safety and so forth as you reopen. So we do have options, brush shields for the slit lamps for opters and BIOs. We do have disposable tonometer tips and lens wipes and so forth as well. From a service standpoint, I do want to mention a few things that we do have offer for you to help you open up and make sure you're staying fully sanitized and so forth. So we do have a sanitization service. We do a complete exam room. We go through all the instrumentation thoroughly and disinfect it and do preventative maintenance if you'd like as well. One of the things I do want to highlight on that is that we follow all the IFUs of the different manufacturers of the various instruments. A lot of you have maybe Reliance chairs and stands and, a Keeler slit lamp or whatever it may be. The bottom line is our service staff is trained and knows exactly what products to use to do those sanitation and cleaning procedures. One of the reasons I bring that up is we had a recent incident with one of our customers where they were using a non-approved disinfectant to clean their slit lamp, and the slit lamp seized up. We had to come in, do a repair on the slit lamp, and then do a procedure as well to train the technicians to properly use the certain particular products to make sure it was doing it properly. Furthermore, with cash flow as always being a consideration and a challenge during these times, we do have some great financing offers from 100 up to 180-day deferred payments, 0% financing, a number of different options if you do need some different instruments to get yourself up, back and running, and so forth. And then finally, from a protection standpoint, because of all the different offerings and companies that are divisions that are under Advancing Eyecare, we have the ability to basically service and support just about everything that's in your office, from the front door to the back door. So we're talking pre-test from Zeiss to Humphrey to back into your exam lane, basically any phoropter, any slit lamp, we can support it. Our service team is fully trained and certified to support those. So what does that mean? It means we can offer you full protection. We call it our umbrella policy. Basically, it covers you from the front door to the back door. If you have any problems or issues with any of those products, we can cover you. One call, that's all you need to do. Some of the different technologies that have been of interest these past 3 months since COVID came into play that I wanted to highlight, just to give you some information out there to help you make your practice so COVID-19 ready, so to speak. So electronic refraction is a big thing right now. This allows you to be socially distant from your patient instead of reaching around them and using the old refractor. Frankly, the phoropter of the old phoropters are generally, the technology, quote unquote, has not changed in about 80 plus years. Electronic phoropters have been out there for a while, but now because of the technology and the ability to now refract your patients from a distance of basically from your desk to the patient has been very attractive to make sure you're being socially distant and safe around your patients. But the other thing is just a great patient experience. The ability to, again, not reach around that patient and so forth. It's a great patient experience, and there's a number of different benefits here I'm going to highlight in a second. At Advancing Eyecare, we have a number of different options that you have to choose from. Of course, our Marco Advanced Technology Division specializes in this. Their sales team are fully trained and able to fully assess your practice and give you some great recommendations on what to do with electronic refraction. On the core division side, though, we have a number of different offerings as well from our vendor partners at Reichert and Topcon as well. So a number of different solutions. Give us a call and we can help you get going on. And some of the benefits that you get with that, besides being socially distant from your patient, there are a number of things. I talked about the patient experience, better patient experience. You can increase your exam time, or if you want to increase your refraction time and spend more of time on a medical exam, you have the ability to do that with electronic refraction. Increased capture rates in your optical as a big benefit for you with electronic refraction. So there's a significant ROI component as well. Ergonomically, again, you're not going to have to reach around the patient. Your shoulder is going to appreciate, your shoulder and your back are going to appreciate this because you can refract right from your desk. One touch of a button, you can send that refraction data into your EMR, very quick, efficient. And then from a maintenance standpoint and sanitation standpoint, it's very quick, just a quick wipe down and you're off and running. And just a couple of other quick highlights I wanted to mention on technology for the COVID-19 practice. Of course, we have a number of different options from pre-owned to new and OCTs and retinal imaging. Slit lamp imaging is another great option to be socially distant and provide a great patient experience. Perimetry, especially the non-bowls, have been a great offering in these past 3 months to make your practice COVID-19 ready. All of these have reimbursement codes available as well, provide some ROI. The beauty of these, though, too, is that these technologies are very easy to clean and sanitize after the patient has gone through and done the procedures. So they generally do not require a technician to be very close to the patient as well. And finally, I do want to offer some our different services. I highlighted a couple things that our service techs do on a regular basis and what they're capable of doing. But one thing I do want to mention is that all of our Advancing Eye Care technicians will arrive in good health, wearing face masks and gloves at a minimum. And again, I just want to reemphasize that all the manufacturing protocols will be followed to do proper cleaning and disinfection if that's what you need to be done. And the bottom line is we will honor and respect all of your office protocols that you set in place to make your practice safe for your patients and yourselves. You can contact our service department at 855-777-2020. And we also have an email, aecservices@advancingeyecare.com. So I will be available in the breakout sessions as well to talk more about these if you so choose. And Shane, I'll pass it on to you.
Thank you again, Joe, for all of the things that Advancing Eye Care and the core of all the companies underneath Lombard, EMS, and Nova S4 Optic, everything that you've been doing and continue to do through the COVID-19, assisting customers and being there ready for not only the sanitation of the products and following those protocols, just everything you've been doing. And thank you again for joining us. At this time, I'm going to pass it to Mr. John Fiak, our regional manager for Northeast Territory. He's going to speak a little bit about some equipment from Keeler that can help during this time. And John, I'll let you take it away.
Thank you, Shane, and welcome everyone. It's nice to be here, and again, it's wonderful to meet all of you. My name is John Fiak, and I serve as Keeler's Northeast United States Regional Sales Manager. What I'd like to do is expound upon some things that we had discussed earlier, and just go into some additional equipment items for your consideration, especially in regards to this climate and kind of along our theme here. Amongst our complete line of devices and equipment are some specific models that I'd like to highlight for you with benefits as to some of the things that we've been discussing. Let's first start off by talking about our Spectra Iris binocular indirect ophthalmoscope. Amongst our complete and comprehensive line of binocular indirect systems, both wired and wireless, we have our Spectra Iris. This was designed as a compact, lightweight, portable indirect with all the necessary benefits needed for clinicians on the move. It's the smallest and lightest binocular indirect available, and many consider the Spectra Iris as a compact version of what their Keeler bios are like in their offices. Perhaps your office, or perhaps offices that you're aware of, have binocular indirects that are shared. Spectra Iris can be considered an option that is more of an individual option, which can reduce cross-contamination. So there's a lot of people that I have come in contact with that simply buy this binocular indirect and use another binocular indirect in their office, and they just wrap this around their neck and they call it their own. It's reducing in cross-contamination. Some of the more specifics about it, it's built on high-quality frames with an LED light and patented Keeler optics. It comes with an eye shield, which snaps in and installs behind the optics body. I think you can kind of see it on the slide or the picture on the very right there. It can be placed away in its own custom carrying case or hung around your neck when not in use. And you can adjust the size of the aperture at the touch of a sliding adapter right on the optics body there for quick and easy adjustment. It also has red-free and cobalt blue filters. And the LED light, in addition, is powered by a battery pack that clips to your waistband and can be used on a single charge for up to about 4 hours. The unit comes with its own custom charging cradle that you can see there in the middle. As you can see on the slides, the frames are kind of a wraparound, similar to our loops frames, or like what some people call like an Oakley frame. So they're secured at the back and very, very comfortable and easy to wear. Let's move on to our TonoCare, our portable NCT. Designed and built with patient comfort in mind, the TonoCare is simple to use and gives a fast, accurate, and reliable reading. This portable unit allows measurement to be taken wherever the patient is most comfortable and whatever that environment they are in. Because of its soft air puff technology, means there are no sterile consumables and oxygen is free. That means there's no additional cost with tips to you. It provides fast readings. The unit is ready once you turn it on in about 10 seconds to use. And in general, you can have readings on both eyes that can be achieved in about 30 seconds. The instructions are easy to follow, and the menu controls are very intuitive on top of the unit. Training can be accomplished in a matter of minutes. It utilizes advanced optical and sensor technology since it's portable for positional detection and puff control. Its station, as you can see on the bottom there, charges the unit when not in use. And it also features on the station a test eye, which can allow an operator to practice using the device. The station also has a cordless connection to its printer with instantaneous data transmission. And as an option, it comes with a USB data output. A final important mention with the TotoCare is that should anyone have any questions or concerns about the potential disbursement of aerosols using this device, I think, Shane, there it is, the green banner. We have a study a clinical study that helps outline some of these concerns, and we can furnish you with that if you want to click on that with some clinical information that can put your mind at ease with regards to aerosols and using a soft non-contact tonometer. Because it's a portable NCT, and with these features, it assures a minimal risk of eye damage or cross-contamination, especially in the fact that you don't have to use any tips. Matt Douglas was showing you a shield that we use with our PSL, or a portable slit lamp, our Keeler PSL. That picture right there shows actually a picture of Matt with the shield in use with the PSL Classic. The PSL was originally designed with versatility, portability, all in mind, while trying to deliver big slit lamp benefits. So some of the features and benefits of the PSL include the fact that it's very popular with clinicians on the go, often visiting settings outside the office, such as nursing homes. The PSL is compact and portable and able to go wherever you're going. Specifically, and more proprietarily to us, we offer a 1 millimeter square light patch that you can simply dial in for assessing anterior chamber flare / uveitis. This is something also that we offer on our big slit lamps as well. With a simple flip of the switch right underneath the optics, you can switch from 10x to 16x magnification. And as you can see on the slide there, it offers a number of key filters and a complete array of slit wheel settings. Again, all largely in line with what you would expect with a big slit lamp. It is LED lights powered, and it's controlled by a rheostat, giving you control of your examination parameters from 0 to 100%. It's a sensitive rheostat. It also includes a charging base, and you can use it while charging. Finally, we don't have a picture of it here, but it comes with a nice, sleek, custom carrying case that's customized and outfitted to hold all of your items so that when you're on the go, you don't have to worry about disrupting the integrity of your optics, and the unit fits in nice and neat. Let's take a moment and talk about our B-Scan Plus Connect. This is for posterior segment imaging. We have a CPT code there on the left, 76512, that is utilized with the use of this device. Our B-Scan Plus Connect comes with unique probe electronics, making it a premier, portable, high-definition B-Scan system. It's reliable and robust, while easy to use, allowing you the portability and quickly access and scans patients and transfer information. Some of the key features that we'd like to highlight here are it's a USB-only connection system. So it's extremely portable and very plug and play and can be taken anywhere. Its image resolution is amongst the best and the highest in the industry. We offer what's called a smooth zoom technology that allows you to go 2x full image zoom without any distortion. Gives you a chance to see things a little bit closer without disrupting the integrity of your image. It also offers 2 scan frequencies on the probe of either 12 or 15 megahertz in one probe, and it plugs into any Windows-based system. It's easy to set up with defaults and provides a smooth interface to EMR reporting and DICOM. There are no licensing fees, and it is compatible with our A-Scan and UBM product lines as well. Another important couple of things to mention is our ultrasound division of our company is always ongoingly providing continuous software improvements with frequent upgrades. It comes in a very durable traveling case with a USB foot switch. It also comes with software and manual, a probe holder, and also coupling gel. It should also be mentioned real quickly that we have a complete in-house team of experts that are ready to assist and support you as well. And that ties in with what I was mentioning as far as continuous software improvements and frequent upgrades. So let's now move on to, finally, our Cryomatic MK2. In our surgical sector, we have a cryosurgery system called the MK2, and it employs a smart, fully digital system through its console. The console you see there right on the left. In general, any probe that is used with this is digitally recognized and provides optimal operating parameters for any probe that you insert. It recognizes it, whatever you put in there. And as you can see on the bottom of the slide, there's a bunch of different vast arrays of probe styles and tips. We also offer a single-use tip, which is why we're bringing this to your attention here tonight. In our most widely used size, which is a 2.5 millimeter standard reach retinal probe. This is offered in a single-use disposable cryo probe, which cuts down on cross-contamination, obviously. Comes in a box of 10, and it's single use, as I mentioned, ergonomic probe every time without any use of any adapter. And it allows you to get your procedure done and toss it away and not have to worry about any cross-contamination. Additionally, and finally, this is a fully digital system that sets up in a matter of minutes. There are many older styles cryosurgery systems still in use today that are rather antiquated, stuffed in the back room of a clinical engineering department and brought out once or twice every year, no longer sold, and more importantly, no longer supported technically. We're in this for the long haul. We have one of the most advanced fully digital systems that are out there. It's very popular, and it's a wonderful alternative. We have the single-use probe designed to make your lives easier with a fully digital technology that most retinal surgeons still need to use and rely upon. So in closing, in addition to everything that we've talked about, any and everything, equipment-wise, we're here to help you. And what we're trying to do to stand behind that and show you that we are embracing this situation as much as you guys are, that we are doubling our warranties. So between now and the 30th of September, any and everything as far as equipment is concerned, ultrasound, diagnostic equipment, bios, as you can see on the slide there, we're going to double the warranty between now and September 30th. But we know you might make a note there, and we would certainly remind you when you order that we'd like to have those products registered so that we can make sure that that is provided for you. And there's a little link there or a little website there on the slide there that indicates that. So that's all I have. I'm going to thank you all for listening in and attending our webinar. Shane, I'll kick it back to you, and I'll certainly also be here if anybody has any more specific questions or anything else that I can do for you.
Thank you, John. So in closing, I just want to thank everybody for coming to the expo today. I appreciate you coming. On behalf of Keeler University and Advancing Eyecare, our guest Advancing Eyecare, we would like to thank you for joining. We are going to be hosting a question and answer session, so I will provide you that link in a moment. And at the top of your screen, you can use this link to jump into our Zoom session. This will provide any and all questions to ask with our speakers, any information we may not have covered, or any questions or ideas you may have, and we'll see you there. So I'll give you a minute. Go ahead and click the top banner. That'll bring you to our breakout session. And thank you again for coming.